Welcome back to the Habit Pelvic Floor Patient Education Series. Our goal in this segment is to reach out to women and improve your body awareness by providing a clear visual of your anatomy so you can better understand the challenges your pelvic floor faces. As you may have heard me say, it was my own journey through pregnancy and delivery that pushed me into the women's health field of physical therapy. But this is simply my story. What I began to realize was that a lot of my female patients in the orthopedic clinic would laugh and joke about wetting their pants when I asked them to perform specific exercises. My grandmother talked about her uterine prolapse, and my pregnant friends were asking a lot of questions about why they couldn't hold their bladder. It was then that I began to realize the widespread effect of weak pelvic floor muscles. It wasn't just a few of us, but as I researched, I found there were millions of us, women of all ages, teenage gymnasts, new moms, older moms, women who have reached menopause and beyond, all experiencing similar symptoms, often in complete silence. We need to start recognizing pelvic floor dysfunction as both preventable and treatable. Women need to stop accepting occasional urine leakage as a normal part of aging. We have to stop thinking that this is what women must endure for the joys of having children. And certainly, we have to stop laughing about it with our friends and do something about it. You can do your part by sharing what you learned with your friends and family. Because the information you will learn on the Habit Pelvic Floor Patient Education Series is information that all women need and deserve to know about how their bodies work. Let me begin with a couple of definitions to make sure everyone is clear on some important terms. Your pelvic outlet is a diamond-shaped area bordered in front by your pubic bone and back by your tailbone, and on the two sides by your two sit bones. Your pelvic floor is a soft tissue that spans this open area. Its responsibility is to hold up your bowel, bladder, and uterus, as well as to control the passage of solids, liquids, and air from our organs through three muscular openings. Let's be honest, that's a lot of responsibility. And when the pelvic floor becomes weak and can't optimally perform these responsibilities, we call that pelvic floor dysfunction. With pelvic floor dysfunction, you may experience symptoms of incontinence, which can include the inability to control your bladder when you laugh, cough, sneeze, or jump. Or it may also be a complete loss of bladder control when you can't get to a bathroom fast enough. Another common symptom associated with pelvic floor dysfunction is prolapse of one or more of your pelvic organs. Prolapse is best described as your uterus, bladder, or rectum pressing down into or out of your vaginal opening. You may hear women say it feels like the bottom is falling out or there's no support down there to describe the sensation that they are feeling. Essentially, a prolapse results when the pelvic floor muscles have become weak for various reasons and no longer have the strength to hold everything up and in. So now we may ask, why are these symptoms of incontinence and prolapse so prevalent amongst women? Why are the numbers so staggering and across every demographic? There are several factors that contribute, but a big reason these symptoms are so prevalent is quite simply our female anatomy. Let's take a closer look at our pelvic floor to help us understand why this tissue is prone to weakness and dysfunction. The reality is that our pelvic floor is a relatively thin tissue made up of 4 distinct layers of muscle that each have their own action. The most superficial layer is our anal sphincter that squeezes to close off our anal opening. The second layer is our urogenital triangle, a grouping of 3 muscles that attach up front at your pubic bone and are mostly sexual in function. The third layer is a urovaginal sphincter that is figure 8 in shape and is responsible for tightening our vaginal and urethral openings. And finally, the fourth and deepest muscular layer of our pelvic floor is our levator ani, that is often described as a sling or a hammock as it runs from front to back with attachment sites at our pubic bone and our tailbone. Our levator ani draws up from its relaxed position to a flattened, tighter position within our pelvic outlet. This muscle action gives better support to our pelvic organs and squeezes tight on the urethra extending from our bladder down to our urethral opening. These 4 layers of muscle are called upon to work as a unit, controlling the passage of solids, liquids, and air from our body, as well as to support and cradle our 3 pelvic organs. as the bottom of our pelvic basket, these muscles are called upon to work against the force of gravity every hour of the day that we are sitting or standing. These factors alone can help us understand the estimated 20 million women that experience dysfunction of their pelvic floor muscles. And we haven't even addressed the hormone changes during menopause or the effect that pregnancy can have on our pelvic floor muscles. The bottom line is the woman's pelvic floor has significant challenges. Recognizing that this is a muscular area of our body is the first step for most. And then seeking a thorough strengthening program for all the layers of our pelvic floor is the second step. Thorough pelvic floor strengthening, including contractions that tighten our pelvic floor and contractions that elevate our pelvic floor, as well as quick contractions versus longer holds, are all very important components of pelvic floor strengthening. We recommend you refer to the Habit Pelvic Floor workouts for thorough physical therapy instruction and pelvic floor strengthening. We'd like to thank you for choosing the Habit Pelvic Floor Patient Education Series.